Hi, my name is Leonardo and I am a family nurse practitioner student at Indiana State University. And today I'll be conducting a neuromuscular examination here with Ricardo. Hi Ricardo.
How are you?
Good, thank you. Do you allow me to test your body today?
Of course.
Okay, so first of all, we're gonna test his muscle strength. So first we're gonna start with shoulder abduction. So that's gonna test C5 and C6. So I want you to please put some resistance against my hands. Go ahead, go like this, please. Very good. So that's nerve C5 and C6. And now we're gonna do, go ahead, you can put them down. Okay, so now we're gonna do elbow flexion, which you're gonna go like this and put resistance against that. Very good, that's good. So that tests C5 and C6, and that tests his biceps and brachioradialis. The next thing is extension, which is C6, 7, and 8, and that's gonna test the triceps. So now put them down and go down against my resistance. Very good. So on all this is 5, which is a normal, which is active movement against gravity with full resistance. Okay. So now we're gonna test his wrist. So go ahead and we're gonna test his wrist, and this is going to test. This is going to test his wrist flexion, and you're gonna do extension. That's C6, 7, and 8. Okay. And this is the radial nerve. So go ahead and put some resistance against my hand. Very good. Now extension, down, go down, down. Very good. So the next thing we're gonna do is the, we already did abduction, okay? And next thing we're gonna do is we're gonna do thumb abduction. So I want you to press against my thumb, my fingers with your thumbs. Very good. Now down. Very good, very good. So that is C8 and T1, that's the median nerve. And we're going to now test the hip. So I want you to, please, no, you can stay there. I want you to put resistance against my hands. Go ahead, go ahead. Very good. So that was hip flexion, which is L2, L3, and L4, which is the iliopsoas. Now I want you to do extension. So go ahead and push down. Push down. Okay, no, push down towards the feet. Towards your feet. There you go. So his 5 movement, which is a full active movement against with full resistance. Okay, so the next thing is the knee flexion. So I want you to press, go ahead, press back. Now with the other. Very good. And that is L5, S1, and S2, which is testing his hamstrings. Okay, the next thing is extension. So I want you to push forward now with both lower legs. Go ahead. Very good. And that is going to test his L2, L3, and L4, which is testing his quadriceps. Okay. Now the next thing is I want you to flex your ankles up. Okay. So flex your feet. Very good. Now down. Very good. That's plantar flexion. So that the ankle dorsiflexion tests for the L4 and L5 tibialis anterior, and the plantar flexion tests the S1, that tests the gastrocnemius and the soleus muscle. Okay. So the next thing we are gonna do is we're gonna test his cranial nerves, and the cranial nerve number 2, we're gonna start with that, and that is his optic nerve. So with that, I'm going to pretend this is a fundoscopy exam. So what I'm gonna do is I'm gonna look inside his eye. So please just look straight at the camera. Okay, and I'm gonna get close to your face. Okay. So go ahead. I'm trying to locate the optic nerve. Very good. Now I'm gonna do the same thing on his other eye. Very good. Once I have that located, I'll look and see if there are any abnormalities. I want you to read those 5 letters that are over there, please. Can you read the 5 letters?
A, Z, W, Y, N.
Okay, so we can see he can read very good. Okay, now the next thing is nerve number 3, which is the oculomotor, and I'm gonna have you chase my finger. Okay, so go ahead. This is gonna test for his muscles around his eyes. Okay, so up, down, out, up. Very good, to the side. Very good. So this nerve also tests for pupil constriction and dilation. Okay, so I'm gonna do that with the light. I'm gonna shine a light on your pupils. Okay, I'm gonna watch for his pupillary response, which they are all both equal, round, and reactive to light. Very good. Now the next nerve is the trochlear nerve, which is nerve number 4, and I want you to look in and down. Okay, so follow my finger. Follow my finger. Follow my finger. You're gonna look in. Now I want you to look down. Very good. So that was the trochlear nerve. Now the next nerve is nerve number 5, which is the trigeminal nerve, which is gonna test in your face. So I want you to please clench your teeth. Very good. Very good. Now I want you to, if you can put some downward motion on my hand. Very good. Very good. And also this test for feelings. Do you feel that around his face? Do you feel that? Very good. Okay. The next one is the abducens, which is cranial nerve number 6, and we already did that also. But that is gonna have him look side to side. Go ahead and move your eyes. Look in just your eyes. Move side to side. Side to side. Very good. Now the next one is the facial nerve, which is going to test his taste. Okay. So do you have taste in your anterior 2/3 of the tongue? Okay. Also his facial expressions. Smile for me. Very good. Now frown like this, like you're angry. Very good. All right. Also nerve number 8, which is the acoustic nerve. This is gonna test his hearing. So I'm gonna whisper some words on both ears, and you're gonna repeat what I say. Okay? Nerve test.
Nerve test.
Very good. Now I'm gonna go to the other side. Hearing aids.
Hearing aids.
Very good. And that test will also entail equilibrium, which we can do the Dix-Hole pipe maneuver, which I'm not gonna do in this video. Okay. The next nerve is the glossopharyngeal, and that tests the anterior 2/3 of the anterior 1/3 of the tongue, which it helps with the speech, and it's gonna also stimulate the uvula. Okay. So the next nerve is the vagus nerve, which is the nerve for. I'm gonna watch for the soft palate to rise. So I'm gonna put this tongue depressor in your mouth, watch the uvula rise, and also watch the soft palate rise. Okay, so go ahead and open your mouth. Say Open, open, open. Very good. So the uvula did move, and the soft palate did rise. Okay. So the next one is the spinal accessory nerve, which I'm gonna have you shrug your shoulders. Very good. Now move your head side to side. Very good. So the next one is the hypoglossal, and for that, that's going to test for movements of the tongue. In this case, we're gonna have you stick your tongue out like this, and we're gonna watch for any deviations. Very good. Okay, so the next thing I'm gonna have you do is go ahead and stand up, and I'm gonna watch you walk. So go ahead and go over there, please, and come walking towards me. Walk normal. So this. Very good. Now stay right there. Okay, now I want you to walk over there that way, but I want you to walk with heels first. Okay, like this, your heels. Very good. Okay, now stay right there. I want you to walk now with your toes. Okay, very good. Go ahead and stay right there. Okay. Now I want you to. You're gonna turn that way, but you're gonna do tandem walking. And that means is you're gonna walk one feet in front of another like this. Go ahead. Go ahead. Oh, very good. Okay, stay right there. Okay. So I want you to do the rapid finger tapping, which I'm gonna have you Do a position of your fingers like this. Very good. All right. Now the next one is finger to nose. So I'm gonna have you touch with your index finger, touch my index finger, and touch your nose rapidly, several times. Very good. Again, not just that one. Very good. Now the other one. Okay, very good, Ricardo. You can come back here. So don't sit yet. The next one is I'm gonna have you lay there, put your head over there, and lay on your back. Now heel to chin. What I want you to do is with the sole of your foot, rub against your lower leg, like this, and you're just making sure they're not missing the spot. Go ahead and rub. There you go. Now do the same thing with the other one. Very good. Okay. Now the next thing I want you to do, go ahead and stand up, please. Stand right there. Put both feet together, hands together, and close your eyes. This is called the Romber's test. We just check to make sure he doesn't fall or he doesn't sway to one side. Okay. Now the same thing, the pronator drift. I'm gonna have you can open your eyes for now. Go ahead and put your arms up like this, and now close your eyes. And this is called the pronator drift. So I'm gonna watch to see. You can open your arms now. We did not see his arms moving to any other way. So that's the pronator drift, which was negative in this case. Okay. So now I'm gonna check his reflexes. Go ahead and have a seat, Ricardo. So I'm gonna start with his bicep. Okay. So I'm gonna have you put both arms like this. Okay. Very good. So I'm gonna elicit this reflex first. You can put your finger there. You see that? Very good. That was the bicep. Now is the tricep. Go ahead and move your arm out like this. Like this. Just go ahead and let it loose. Very good. Very good. Now the other one. Go ahead and let it loose. Very good. Now the next one is the brachioradialis, which is put your like this again. Okay, very good. All right. Now the next one is the quadricep, which is the same as the patellar or the knee reflex. Okay, so I'm gonna do here. That was a little bit of. Okay, very good. The next one is the Achilles or the plantar response. So in that case, I'm gonna tap back here. Very good. Now the next one is the plantar response I can do, or the Babinski sign, and in that case I'm gonna touch here the bottom of his foot. Okay. So I'm gonna start with the outer side. Okay. And stroke the. Okay, very good. Now the Hoffman sign is. Go ahead, show me your fingers. In the middle finger, I'm gonna go like this, and he shouldn't have any opposition of his thumb and his index finger. Okay, when I do that. So his is negative. He doesn't have that. That's very good. Okay. Now, while you're there, go ahead and stand up, please. I'm gonna do the scratch test. The scratch test is I want you to turn and act like you're scratching your back with this hand. And this one up. Very good. Do you have any pain there? No, do the opposite now. This one up and this one down. Do you have any pain there? Okay, very good. You can, now I want you to do the acromioclavicular test, which I want you to go ahead and put like you're putting a scarf over your shoulder. Very good. Do you have any pain there? No. Now do the same thing with the other arm. Any pain there? No. Okay, the Hawking-Kennedy test, I want you to go ahead and go like this, okay? And I'm gonna move it down and you tell me if you have any pain. Do you have any pain? No. Okay, very good. Now I'm gonna do the Mears test, which what you're gonna do is you're gonna flex your arm like this and put it all the way up, all the way up. And try to go like this, okay? Do you have any pain there? No. Very good. Now the other one. Turn it, turn it, turn it inside towards you. Very good. Any pain?
No.
Okay. Now the lateral sinus, I want you to lift your head like this and go as far as you can. Okay. Very good. You're gonna watch. Make sure he doesn't have any pain or he doesn't have anything bothering him. Go ahead, do the same thing. Very good. Okay, now the drop arm sign. So I'm gonna have him extend his arm and just let go, and make sure he doesn't just fall. Okay. Now let's do the same thing with the other one. Go ahead. I'm gonna let it go. Very good. Now the can test. So the can test is like put your arms forward like this, and act like you're emptying a can. Very good. Now go ahead, leave it like that. Do you have any pain there? No? Okay, you should not have any pain there. Very good. Now you can relax. Now the Frankenstein test is we're gonna test for the curve and tendinosynovitis, which I'm gonna have you put both thumbs inside your fingers like this. Very good. And I'm gonna have you do this. Do you have any pain there? No. Or you can passively do it and see if he doesn't have any pain there. Okay. Now the Tinel sign is I'm gonna tap. Just relax your hand. Relax. I'm gonna tap here the median nerve. Do you have any pain there or tingling? No. So that's the Tinel sign. Pain there? No. Okay. Now phalanx, I want you to do like this. Hold both arms together and put them up. Like this. No, straight. No, relax. Straight like this. Very good. Leave him there. We're gonna leave him there for 30 seconds. Make sure he doesn't have any tingling or pain in his hands. Okay. How do you feel that?
Good.
Good? No tingling, no pain? Okay. Very good. Okay. So I'll go ahead and relax. And before we go to the lower extremities, I'm gonna have you just do some neck flexion, just like this. Flexion. Now back extension. Now lateral bending to the other side now, and rotation. No, rotation. Very good. Very good. Now shoulder. So abduction, and internal rotation. So you can do like this. Okay, very good. Okay, and external rotation. Okay, very good. Now elbow flexion, like you flex your elbows. Okay. Extension, okay, supination, and pronation. Very good. Okay, now wrist flexion, extension, okay, and ulnar and radial deviation. Very good. Now finger, we're gonna do finger flexion. So close your fingers like this, finger extension, okay, adduction, because you're gonna add them, and abduction. You're gonna open them. Very good. Now go ahead and lay down, please, with your head over there, feet over here. We are going to do the hip internal rotation. So what you're gonna do is hip internal rotate. Very good. Now same thing with the other one. Hip internal rotate. Very good. Now you're gonna do extension of the hip. Okay, very good. Now we're gonna do the knee. Go ahead and sit down. Knee flexion with both knees, both extension. Very good. Now we're gonna do ankle flexion, just your ankles up, plantar Very good. Okay. Now inversion to the side. Very good. Now go ahead and stand up. We're gonna do vertebral column flexion, which is you're gonna flex your vertebral column. Go ahead and move up. You're okay. Now extension to the back. Very good. Now rotation and lateral bending, which is to one side, then to the other side. Very good. Okay, go ahead and lay down, please. Lay down over here. Okay, so the first thing we're gonna do is the Faber test, which what you're gonna do is you're gonna flex Okay. Adduct and put put your feet on top. Very good. And watch. Do you have any pain there? If you go down, if you press this knee down, he doesn't have any pain. We're gonna do the same thing with the other one. Do you have pain?
No.
Okay, very good. Now we're gonna do the fattier test, which we're gonna flex. Okay, but before that, we're gonna have you lay on your side just a little bit. Okay, very good, very good. So we're gonna flex. Okay, and we're gonna internally rotate. Do you have any pain there?
No.
Okay, do the same thing now on the other side. Flex. Relax, relax. Flex. Do you have any pain there?
No.
Okay, very good. Now the Lachman test, go ahead and lay like this. The Lachman is you're gonna bend his knees a little bit, put them straight, okay? And we are going to pull over here, hold on, relax. Pull on the, and this is just about 15 to 30 degrees, okay? We're gonna rotate, internally rotate his tibia, okay? Do you have any pain there?
No.
Any pain there?
No.
No? Okay, very good. Now, the next thing is we're gonna do the anterior drawer sign, okay? Which gonna flex them a little bit more, and I'm gonna pull. Any pain?
No.
Pain?
No.
That's testing the anterior cruciate ligaments. Now I'm gonna do the posterior drawer sign, which I'm gonna push in. Do you have any pain?
No.
Or making sure he doesn't have any instability? Pain?
No.
Okay, very good. Now the next thing is I'm gonna do the tight thrust test. Okay, so what I'm gonna do is I'm gonna have him bend this knee. Okay, I'm gonna put my arm under his buttocks and I'm gonna press down on his knee. Any pain?
No.
Okay, now same thing with the other one. Any pain?
No.
Okay, very good. Now the next thing is the Kemp's test. Go ahead and have a seat, please. And you're just watching for his, you're just moving his neck from one side. Do you have any pain there?
No.
And if you had any pain or radiculopathy that moves toward the arms, that would be a positive sign. We're gonna do the same thing with the other one. Pain?
No.
Okay, very good. Now the next one is the McMurray test. Okay, so go ahead and lay down, please. Okay, and for that, what I'm gonna do is having bend his knee, and I'm gonna rotate his tibia, his fibula, okay? Make sure he doesn't have pain, and this is testing for his meniscus. Do you have any pain?
No.
No? Pain or crepitus will be indicative of that. Any pain?
No.
Okay, very good. Go ahead and relax there. Okay, the next thing is the valgus stress test, which in this one, I'm gonna put some pressure here on the ligament, on the medial collateral ligament, and I'm just gonna bend it, make sure the space doesn't open inside, okay? Now the other one is the lateral collateral ligament, or the varus stress test. I'm gonna try to open here, okay? Make sure he doesn't have any pain. I'm gonna do the same thing, varus stress test. Now internally, the valgus stress test. Very good. Okay. Now the next thing I'm gonna do is the already did the anterior, the posterior. Okay. So I think that that's all, everything in this exam. Thank you so much for watching. Thank you so much, Ricardo, for your help.
Thank you.
Have a good day.
Guess what?
Yeah.
Handshake.
Handshake.